Good morning. This is Dr. Krishna Patel from New York, US. It's my pleasure to be here at the World Congress of Imaging and Cardiology in Mumbai. I just finished a talk on stress PET myocardial perfusion imaging and why is it the non-invasive gold standard for evaluation of coronary artery disease. Some of the key advantages of a stress myocardial perfusion PET are that it is low radiation, it has superior diagnostic accuracy, and you can diagnose not only your obstructive epicardial disease, but you can diagnose coronary artery disease across the entire coronary circulation, also including the microvasculature. So you can diagnose patients with coronary microvascular disease or dysfunction. You can do it at low radiation. It is more accurate. There are multiple advantages for risk stratification. There are many markers on a PET study which can help you better risk stratify your patients with suspected or known coronary artery disease, and it can help you better select patients who will benefit from revascularization downstream. PET perfusion tracers are short-lived, and because of that, the PET protocols are very short. You can finish a whole study in about 30 minutes or less. As far as risk stratification goes, what are some of the measures that you can get with a stress PET myocardial perfusion imaging that you don't get with a typical stress test? First, currently PET is done with a pharmacologic stress with Lexi scan, where you inject medicine to raise your heart and then look at the blood flow to the heart. In addition to just the perfusion images, you actually get coronary calcium information on a lot of PET studies. You also get information on the function of the heart and how well the function of the heart responds with stress. So you can get ejection fraction information at rest and at stress, and you can see whether the ejection fraction goes up with stress or goes down with stress, and you can get information on coronary calcium. So you can get information on subclinical calcified atherosclerosis. But one of the main advantages of PET is the ability of PET to be able to quantitate actual myocardial blood flow that is going to the myocardium, both at rest and stress. And because of that, because of the ability to actually measure how much blood is going to the myocardium, we can diagnose disease. We can diagnose small vessel disease. Microvasculature is very small. We cannot see it with naked eye, but if there is disease in that, it can cause symptoms, and the PET can help you detect that disease as well. It can help you more accurately measure the extent of disease. So how many vessels are affected by coronary artery disease. These measures of function, ejection fraction, myocardial blood flow quantitation, and coronary calcium on PET, in addition to perfusion, they can better risk stratify those patients who are at a higher risk for having future heart attacks or dying from heart failure or heart attack in the future. In addition to ischemia on a PET study, you can use these markers of ejection fraction, also known as LVEF reserve, or myocardial blood flow reserve, blood flow quantitation, to better identify which of these patients we should refer to a cath lab to get a stent or bypass surgery so that they can live longer. There are many advantages of PET which I summarized in my talk. Typically we use stress PET imaging in more higher risk patients who have multiple comorbidities, who cannot exercise, to help diagnose coronary artery disease and to risk stratify them. We also use it in order to understand why they're having symptoms. Is this from coronary artery disease? Is this from microvascular disease, or is this from something else? And then we also use stress PET imaging to better identify which of these patients should be referred for angiogram so that they can benefit from stenting or bypass surgery. Thank you.